Thank you, Dr. Santosh. Thanks for that humble introduction. So it was part of my job moving to all the states and finally last 2 years I've been in the panel and having this discussion on early development. When we say Child Rights Commission, we see as UNICEF, it is just extended arm of UNICEF in India. We don't see Child Rights Commission as separate from UNICEF. And I think maybe one day UNICEF will wind off from India. I think Child Rights Commission will take the flag of child rights and
I hope they will take, but you will also stay.
we want to become relevant so that the institutions take by themselves. So with this, the last 15-20 minutes, I'll just try to orient you on what the science is behind the early childhood development. I'm not trying to bore with the programmatic part of it, which is our bread and butter, but because I thought there are students from basic sciences, nutrition, even our MBBS students are there, students from physiotherapy are there. I think I thought it was more interesting for you to look the science behind it rather than the programmatic part. Before starting, I just want to ask a question. This conference is NurtureCon. Why it is not NutritionCon? We are talking of nutrition, right? Anyone? Maternal and child nurturing is the main part of nutrition. Okay. I'll just try to reverse it. Nutrition is part of nurturing. Nurture is not part of nutrition. That is why nutrition is subdued under this title of this conference of NurtureCon. So there is $1 million question which all the archaeologists, the neuroscientists, the evolutionary scientists try to understand. What makes a person intelligent? We are all intelligent, no? What made you have that intelligence? Is it the nature or is it the nurture? Till now, even though in our culture, in our tradition, we know the importance of nurture, but scientifically, medically, neuroscience, genetically, it was always, the argument was by the nature, it is genetics. The moment we understood the DNA, the helix model and all, the scientists were more focused on that it is the genes. If you have the genes, you are intelligent. If you don't have the genes, whatever you do, you cannot be intelligent. So that was the philosophy. But after 1990s, a lot of research coming in neurosciences now tells that it is not only your genetic makeup. Even if you have genetics to become intelligent, you can become less intelligent if there is no nurturing. So both go in hand. You should have that nurture, the nature, you should have the good genes. If you have genetic abnormalities, definitely you suffer. You cannot question that. But even if you are genetically potential, if you don't get that environment for you to fully develop, even if you have good genes, it is of no use. So that is the philosophy of entire between the nature and nurture. So with this, we'll just go to a few slides. Next. I think it's not much visible from behind, but don't worry, I'll be explaining more of it so that it will not be repeated on the slides. So this slide just shows how evolution happened. See, from single cell we are becoming humans. In between we had fish, reptiles, animals. So this entire evolution we had over millions of years was more of physical evolution, less of your brain evolution. From one cell, multi-cell, then aquatic animals, then they developed legs, they developed feathers, they developed tail, and then they started walking up. This is all physical evolution. But when it came to humans, this physical evolution stopped. The further evolution in biology was only about brain. Nothing else developed after that. It was only brain which is developing. So from chimpanzees or the three mammals to now the Homo sapiens, the difference is only about the brain, with less much difference about your physical appearance. Got it? You are on the same page? Now within brain, till the brain was around 1000 cc, we were called as Homo erectus. When it became up to 1500 cc, we are called as Homo sapiens. So now the volume of the brain has reached at its peak. So now we have not seen in the evolution in the last 1000 or 2000 years the increase in the size of the brain. It has stopped. So the next part of the evolution is within that existing volume of the brain, how are you nurturing to reach your evolution to its maximum potential? Next. So when I say the brain is now the part of the evolution, this is the human brain and it has three parts. I will justify this in next slide why I am explaining you these three parts. Human brain has three parts. The first part is called as a reptilian brain, or it is called as a lizard brain. It is, in medical terms, it is called as brainstem. This part of the brain helps you to address immediate risks, whatever the animal or a person faces. It is a fight and flight response. Somebody hits your stone, you suddenly run away. There is no emotions in this. That is why when somebody cries without any reason, we call them crocodile crying. Crocodile tear. Because crocodile is a reptile, it has no emotion. So he is not crying because he has emotion, just he is crying. So that is the reptilian brain. Second is the mammal brain, which is the limbic brain, which developed over evolution, that you have started getting emotions, the memories, the habits, and all. And the third is most important, the peak of evolution is the cortex. The cortical part of the brain, which is called as cortex, your language, your consciousness, your abstract, your reasoning, your cognitive abilities, everything is because of this. Now, what is important to understand in these three is, when the baby is born, the first and second part of the brain is already developed. But the third part of the brain is yet to develop. So if there is no environment for that to develop, they will be stuck up in this. So it is the responsibility of the society that after the baby is born, how can we stimulate this? The third part of the brain, which is the most important part of the brain, which differentiates humans from others. Fine? Now go to the next slide. So this is how brain looks like in a baby while the baby is inside the mother's womb. Mother is pregnant. If you see the lower part of the images, they are all animated images. If you see the upper part of the images, they are the real brain specimen photographs. I don't know how much you will be able to appreciate. In the early weeks of pregnancy, 26 weeks, 27 weeks, 29 weeks, the brain is very smooth. You can see the real brain, animated images. But the time the child comes up to 34 weeks of pregnancy, you can see these elevations and the, we call it as gyrations and sulcations in neurological term. This determines the number of neurons and neuronal connections happening in the brain. And if you see a brain of a baby inside the mother's womb at 40 weeks, and if you see a brain of an adult, it's almost same. Are you able to appreciate? It's almost same. So the most of development of the brain in terms of volume happens during pregnancy. Now why this is important? Along with nutrition, as a nutritionist, as a medical professional, what you need to advocate? Go to the next step. This is significance. Just by 40 weeks, 100 billion neurons are formed in the brain during pregnancy. Every minute, 250,000 neurons are being formed, and each neuron has 10,000 to 15,000 connections. So almost every single day in the first 1,000 days of life, 700 neural connections happen. That is the importance and that is the seriousness. Next. See, this in medical terms, during pregnancy, we say 37 weeks of pregnancy. Before the 37 weeks, if the baby delivers, it is preterm. After 37 weeks, if the baby delivers, we call it as term. Okay? Now, how did we decide it that 37 is the cutoff? Why not 36 weeks? Why not 38 weeks? I will not go for more interaction because time is less. Just because at 37 weeks, the respiratory system of a baby is fully developed. So even after baby is delivered, it can breathe, it can live. So they decided that 37 weeks is a cutoff. for preterm and term. But brain is not developed at 37 weeks. So we are looking only from the survival point of view, but not the intelligence of the baby. So 39 weeks is the cutoff where you can reliably say that the brain of the baby is developed. So now we are turning it as the term which was above 37, now they have made two cutoffs. Less than 39, 37 as early term and full term after 39 weeks. Why this is important? 60 to 70% of deliveries are happening cesarean section. And they are all looking at this 37 cutoff for survival. So they are not waiting till 39 weeks. 2 days back in the newspaper, because of the auspicious days of festivals now, everybody is opting for elective cesarean section without even knowing that their baby is developed or not. Next slide. So, to have a healthy and an intelligent baby, it is worth the wait. Please wait till 39 weeks. So, if you see a pregnant woman, if you are providing nutritional counseling for a pregnant woman, please counsel her to wait till 39 weeks. That will have a huge impact. And the last 4 weeks of pregnancy is the maximum growth of the baby compared to the entire 9 months of pregnancy. Next. Maternal stress. I saw one of the in the poster presentation above NIH study where the maternal stress is contributing for the cognitive development of the baby in future. It's very, very, very good. The most important factor during pregnancy is how to see that mother doesn't get anxiety, mother doesn't get depression. There is no stress at all. Stress has huge impact on preterm delivery. There is almost 30% of the preterm deliveries, one of the reason is distress. And preterm delivery is the major cause of mortality among newborns. Next. Dr. Santosh in the morning last session was asking you a question. The 32 sweet teeth we have, what decided, and I think you told that answer, that what mother is getting complementary feeding, what we are feeding, determines whether they eat sweets or not in the future. But there is one more concept called as, and somebody also told, while breastfeeding what mother eats, it determines what you grow. But there is one more concept, it's called as flavor-rich concept. If you want to have a successful complementary feeding, if you want to have your baby eat all the diverse food, it all depends what mother eats during pregnancy. If she has likes, dislikes, and doesn't have a diversification of foods during pregnancy, the same baby will continue at complementary feeding. And that is called as flavor bridge. It is at the upper part of the nose of the mother's brain. So, whichever part from there, the signals goes to the baby, and baby already, even before delivery, it knows what to eat, what not to eat. So, it is so much important when we talk about responsive parenting, the respectful maternity care during pregnancy, and all these concepts become so important. Next. Yoga during pregnancy. One of the most important intervention which we don't talk, even though India is the homeland for the birth of yoga. Every Western world is doing yoga during pregnancy, except Indians. We want fancy aerobic exercise, gym and all. But Harvard has done study with all types of exercise compared to yoga and decided that yoga is better than any other exercise during pregnancy. All the major maternal complications and newborn complications can be prevented directly or indirectly, and 80% reduction in stress, which is the major cause of all the complications, can be reduced by yoga. You see the celebrities, I think Narada initiated, Sora Ali Khan, recently even Deepika Padukone. You can see Anushka Sharma and Virat Kohli doing yoga, Anushka doing yoga during pregnancy. So now celebrities are coming, but it has not gone into the grassroots. Next. The Women and Child Development Department, Government of India, has come up with a protocol for yoga during pregnancy for first trimester, second trimester, third trimester. Mayo Clinic, which is considered globally the standard clinic for all the medical references, we go to Mayo Clinic, what Mayo Clinic is practicing. They have a protocol for yoga during pregnancy. Harvard has protocol for their own employees to have yoga during pregnancy. So nutrition coupled with these interventions will give maximum benefits. Next. So 2-3 more concepts I want to introduce to you. Who starts the labor? After 9 months, delivery happens on an average 37 to 40 weeks. Why does it doesn't happen at 8 months? Why doesn't happen at 10th month? Why it happens at that point of time? The evidence till now was when the baby size is big, the uterus stretches and it is not able to hold the baby for a longer time, then it starts contracting and delivery happens. So till now it was thought it is only mother who decides when the baby has to be delivered. But recent concept is totally reverse. It is the baby who decides when to come out. One of the important factors is whenever the glucose level within the baby comes down to less than 15% of its metabolism, so it is not able to get nutrient from the mother no more what it requires. It triggers cortisol from its brain, which goes to the placenta. It introduces the progesterone comes down, the estrogen goes up. That stimulates the brain of the mother. Then oxytocin is released, and then the baby is delivered. So in cesarean section, you are not allowing baby to decide to come out. You are deciding when to come out. Induction of labor or anything. And in preterm delivery, when you have other maternal complication like stress, even though baby doesn't want, because of stress, preterm delivery is happening. So we are inhibiting the most important neural reflex in the baby if you are delivering it before the term, before the labor really starts. Next. I'm not going to the detail. There is a subtle talk between the brain of the mother and the brain of the baby in deciding the delivery. Next. Yeah. Another very important concept from nature and nurture point of view. See, I told oxytocin is released. Don't go into technical details of it, just understand that oxytocin is released for the baby to deliver. Now you see when oxytocin is released. This is the level of oxytocin. At delivery, oxygen is this much. But the peak of oxygen, oxytocin, is 30 minutes post-delivery. Now oxytocin is required for conducting delivery. The baby has to come out. Now the baby has come out. Why oxytocin is peak after that? What is its job? Yeah. Oxytocin is the hormone which creates bonding. So if you separate mother and baby after delivery, this surge is lost. At this surge, if mother and baby come together, you can easily initiate breastfeeding. You can easily continue that breastfeeding, that bonding. Even it helps the recovery of the mother from the labor or injuries happening. So, not separating baby from mother. In hospital, if you see, after delivery, baby is taken out, mother is there, everything happens. Once mother goes to postnatal ward, then baby is brought to her. And if baby has small complications, they are taken to NICU, mother doesn't see the baby for 3 days. So this is the most important point from nurture point of view. Don't separate baby. Next. So this is all I spoke about what is the science during pregnancy and during delivery. Last, after delivery. Your first, out of first 1000 days, the first 300 days we spoke, the next 900 days. You see this graph. This one is at the time of delivery, this period is during pregnancy, and this period is after delivery. Can you see when is the vision and hearing, the sensory pathways are developed in a person? It starts 3 months before delivery. You see higher cognitive functions for man. It starts 3 months before delivery. It is not that after delivery you go to Anganwadi or go to school, you have higher cognitive functions. You are having it here. In Sanskrit, for sensory organs in Sanskrit, there's a very beautiful word. It is called as Gnanendriya. Gnana plus Indriya. Indriya is senses, your sensory organs, and Gnana. So it all develops. If you want to have that intelligence, it is how your sensory organs develop. Similarly, language. Language is not what the child develops after 1 year. It says baba, mama. After 1.5 years, it starts monosyllable, two syllable. Nothing. It starts here, and it's already started peaking at the time of delivery. And you see, the first peak is in the first 1 year. Language is even less than 1 year. Higher cognitive function is between 1 to 5 years. So if you want a baby to be intelligent, if you want a baby to learn more languages, so it is this period where you have to teach them. A child less than 5 years can easily learn 6 languages. It's the same, it takes 20 years efforts for an adult to learn a new language if he is not stimulated in his early childhood. So this is the importance, and this graph comes from Harvard, all the research which Harvard has done, and this is the classic math which we use everywhere whenever we speak about ECD. Last 2 minutes, next. So first 1,000 days are more critical, not only critical, as the caption of this conference says, it is decisive. If you lose that, you are lost. Recently, when this current union election happened, the Prime Minister's office made a committee, Economic Forum Committee, to suggest the Government of India that if they come to power again next term, what are the priorities the government should have so that India becomes a Viksit Bharat, a developed country. So 30 top economists of India sat together, discussed, and after 3 days they came out with recommendations to Prime Minister's office. 10 things which government has to do in order to become superpower. Do you know what was the first recommendation? Invest in first 1,000 days. And they called it as Buddhiman Bharat. You make your people intelligent, they will take care of their economy. So Buddhiman Bharat was the first recommendation. Next. So same in bar graph which I showed in earlier slide. Next. You see this, the brain of the baby during pregnancy. When a mother talks, there is a different part of the brain which activates. When a stranger talks, there is a different type of brain which activates. So mother should not be made isolated in a house when pregnancy. She should be talking to new people, not only family members. Then it will stimulate all the other part of the brain. Mama, Kaka, Tata, Dadi, everybody, friends, everybody should be talking during pregnancy. Next. So this is the Lancet continuum of care first 1,000 days. What intervention has to be done during adolescence period, during pregnancy, during labor, and then after 5 years. Next. The highest rate of economic returns, this is what the economist told, comes from first 1,000 days of life. Next. So that is why in Millennium Developmental Goals, we are talking about survival. Now we are shifting gears in Sustainable Development Goals. That is just not survival, but it is survive, thrive, and develop. So that no one is left behind. So these are the global guidelines on agricultural development from Lancet and WHO. Next.